Thinking about inpatient detox, but not sure what actually happens behind those doors? You're not alone. For many, taking that first step is the hardest part of recovery, but it's also the most life-changing. In today's video, we're breaking down exactly what happens at an inpatient detox center, from check-in to recovery, and how it helps you or a loved one take that crucial first step towards sobriety. So let's start with the basics. What exactly is inpatient detox? Inpatient detox is a medically supervised process where you live at a treatment facility while your body clears drugs or alcohol. It's often recommended for people detoxing from alcohol, opioids, or benzodiazepines, especially when withdrawal can be intense or even dangerous. You'll follow a structured schedule of meals, therapy, and medical check-ins, all while being monitored 24/7 by professionals. So what does the process look like from start to finish? It usually unfolds in these three key phases: intake and assessment, managed withdrawal, and then transition to rehab. Let's break those down. When you arrive, the first thing you'll do is complete a detailed intake. That means reviewing your medical history, your substance use, and checking for any mental health conditions. Why? Because your detox plan should be personalized. No two paths to recovery are the same. Next up is the core of detox, managed withdrawal. This is where the real work begins. Doctors may prescribe FDA-approved medications to ease your symptoms and keep you safe. At the same time, you'll start behavioral therapies like cognitive behavioral therapy or CBT, motivational enhancement therapy, and individual and family counseling. It's not just about clearing your body, it's about supporting your mind, too. Here's something many people don't realize: detox alone isn't enough. Once you've stabilized, you'll transition into full rehab, whether that's residential care or an outpatient program like PHP or IOP. This phase is where you'll dig into why you use substances and start building tools to prevent relapse. Now let's talk about medication-assisted treatment, or MAT. It often begins during or right after detox and can continue for weeks, months, or even years, depending on your needs. It works in 3 stages. First up is induction. You start medication to reduce cravings and withdrawal. Then stabilization, where your body adjusts as symptoms improve. And finally, maintenance or weaning will occur, where you either continue long-term or taper off under medical supervision. Now, not all detox programs offer the same level of care, and that matters. Depending on your symptoms and medical needs, you might need more intensive support. That's why detox centers follow a set of national guidelines to match you with the right level of treatment. Let's break down the 3 main levels of inpatient detox, as defined by the American Society of Addiction Medicine. Level 3.2D is non-medical or social detoxification, where care is primarily peer-supported but staff-supervised. The next level is Level 3.7D, which is clinically managed, medically monitored detox with round-the-clock nursing care and as-needed medication. And lastly, there's Level 4D, which is hospital-grade, intensive detox with continuous physician oversight, frequent vitals monitoring, and emergency response capabilities. Your level depends on your withdrawal severity, co-occurring conditions, and overall treatment complexity. Let's touch on who should consider detox. If you're using alcohol, opioids, or benzos, and especially if you've been using for a long time or have co-occurring conditions, inpatient detox is often the safest route. The risks of going it alone can be serious. Fortunately, a range of detox facilities exist, each offering different approaches to sobriety and support. Here's a sobering fact: only 14.6% of people with substance use disorders received treatment in 2023. Even fewer got access to medication-assisted treatment. The biggest barriers? Lack of insurance, no nearby facilities, financial challenges, or a stigma people feel around detox. And it hits women, BIPOC communities, adolescents, and veterans the hardest. Let's quickly go over common detox timelines depending on your substance and level of addiction. Alcohol typically takes 2 to 7 days. Detox for short-acting opioids lasts 4 to 10 days. Rehab for long-acting opioids takes closer to 10 to 20 days. And a detox for benzos takes about 10 to 14 days. Your age, health, and usage history will play a role in these timelines. Let's talk briefly about the medications that may be used during detox. These aren't one size fits all, but they're carefully chosen based on what you're detoxing from. If you're withdrawing from alcohol, your care team might use medications like naltrexone, which can help reduce cravings, or acamprosate, which supports your brain as it begins to rebalance. For opioids, options include Suboxone, a combination of buprenorphine and naloxone that eases symptoms and reduces relapse risk. There's also methadone, which is sometimes used for more severe cases, and Vivitrol, a monthly injection that helps block the effects of opioids altogether. When it comes to benzodiazepines, detox is a bit more delicate. A medication called flumazenil may occasionally be used under supervision, though it isn't FDA approved specifically for detox. Some clinicians find it helpful in certain cases. These medications are just one part of a medically managed detox plan, and they're always used with your safety and comfort in mind. So what happens after detox? You'll usually move into inpatient rehab or an intensive outpatient program or IOP. There, you'll continue therapy, build coping skills, and create a relapse prevention plan. IOPs let you live at home while attending treatment a few days a week, usually 9 to 20 hours total. Whether inpatient or outpatient, the goal is the same: give you a sustainable path to lifelong recovery. Finding the right detox center can feel overwhelming, but there are resources out there. Check with your doctor. You can also use Detox.com's treatment locator to explore options near you. Many centers can help verify your insurance or set up sliding scale fees. Don't let cost stop you from getting help. As we wrap up, here are a few common FAQs on this topic. What is the difference between detox and rehab? Detox clears your body of substances. Rehab helps heal your mind and change behaviors. Can I detox without insurance? Yes. Many programs offer free or low-cost options. Always ask or use Detox.com to find free detoxes. How much does inpatient alcohol detox cost? The cost of inpatient alcohol detox can vary widely, but here's a general breakdown. Without insurance, expect to pay $3,000 to $10,000 or more for a typical 5 to 7 day stay. With insurance, many plans cover part or all of the cost. Check with your provider. Some centers offer sliding scale fees, payment plans, or state-funded programs for those without coverage. Detox shouldn't be out of reach. If cost is a concern, speak with the admissions team. They'll help you explore your options.